Dense breast tissue is a major risk factor for breast cancer. If we compare the group of women with dense breasts to the group of women with non-dense breasts, the risk of breast cancer is 4 to 6 times higher in the group of women with dense breasts. Today, we cannot offer these women any kind of prevention therapy. So what is breast density? Well, there is nothing that is visible or can be found during physical examination of the breasts. Breasts that appear white on a mammogram are dense, and breasts that appear gray on a mammogram are non-dense. The white on the mammograms represent fibroglandular tissue, whereas the gray on a mammogram represents fat tissue. So what's the reason for the increased risk of breast cancer in dense breasts? Well, that's the big question. Today, we do not know why dense breasts have a higher risk of breast cancer as compared to non-dense breasts. And that's why we became interested in this research question. The first thing that has to be done before a preventive therapeutic could be offered women with dense breasts is that we need to understand basic biology of breast tissue and to understand how dense breast tissue differ from non-dense breast tissue. So we did a study where we compared dense breast tissue of postmenopausal women to non-dense breast tissue of postmenopausal women. We collected tissue fluid from the breasts from these women, and we analyzed proteins in this tissue fluid. The proteins in a tissue is the messenger of the intercellular crosstalk and the regulator of the biology. In total, we were able to quantify 270 proteins in the tissue fluid. And of these, 124 proteins were upregulated in dense breast tissue. And these proteins are regulators of inflammation, angiogenesis, which is the development of new blood vessels, and growth in the tissue. So our data indeed suggests that there are major biological differences between dense and non-dense breast tissue. And with this comprehensive characterization of dense breasts, we have revealed novel pathways that could be explored for future therapeutic options and in the development of preventive therapeutics. As a result of our data, we have performed a small explorative clinical study where we have identified women with dense breast tissue on the mammography screening program, and we have given them a low dose of non-inflammatory or anti-inflammatory therapeutics for 6 months. And our very preliminary unpublished data indeed suggests that we can actually decrease the inflammation in dense breast tissue. And whether this has any implications or will reduce the risk of breast cancer for these women is yet to be explored. So we are continuing this research, and hopefully we can discover means that could be used for the prevention of breast cancer for women with dense breasts in the future.